Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Forest Medicine. Today's video will continue with agriculture compound poisoning. In this video, we'll talk about poisoning from paraquat, pyrethrins, and nitro compounds and other compounds, fluorides, etc. Coming to paraquat, paraquat is a bipyridium compound and is used as herbicide and weed killer to remove unwanted plants. It is used. It is sprayed on weeds before planting crops to remove unwanted plants. At 10 to 30% of strength, it is commercially produced as brownish liquid and it is sold as a trade name of gramoxane. At 5% strength has brown granules, it is called as Vidal. So in that 5% it is sold as granules in the name of Vidal. Coming to death usually occurs due to ingestion of paraquat. So whenever the person consumes the paraquat, the person dies, but by inhalation, death by inhalation by spraying is very rare. Come to action of mechanism of action of paraquat. Paraquat undergoes an ATPH reduction, dependent reduction. So paraquat whenever comes in contact with NADPH in the cells, they form free radicals. These free radicals combined with oxygen forms cations and produce superoxide free radicals and hydroxy radicals. So these hydroxy radicals and free radicals disrupt cellular function and cell death. Consider a solution that is more than 10%. If more than 10% or 20% of solution of paraquat is present, they corrode the GI mucosa and have corrosive action. Coming to absorption excretion, absorption is mainly through GI tract. As I mentioned, it is absorbed mainly from GI tract, less from the other mucosal surfaces. So through inhalation, skin or eye contact is very minimal. It is distributed all the organs, but highest concentration is in the kidneys, lungs, followed by muscles. So they are present in kidneys, lungs. From kidneys they are excreted in the urine. In the muscles they are stored as a reservoir. So whenever there is concentration of paraquat decreases, the muscle releases paraquat into circulation, back into circulation as plasma concentration decreases. So this causes the paraquat concentration to increase and it is maintained so that the poisoning continues. More than 90% of absorbed paraquat is excreted unchanged in the urine within first 24 hours, but can be detected in urine up to 3 weeks after ingestion. So first 24 hours it is excreted, but it can be detected even after 3 weeks. 5 to 10% is absorbed and rest is excreted. So 90% of person consumed is excreted in the urine. 5 to 10% is absorbed in the bloodstream and has poisonous effect, and rest of the thing like 5% is excreted in the faces. Coming to signs and symptoms, locally it causes irritation and inflammation action on the skin, nails, cornea, conjunctiva and nasal mucosa. It causes mainly inflammatory action. In GI tract again it causes mainly of corrosion action, corrosive action. It causes ulceration, nausea, vomiting, hematemesis, diarrhea, painful mucosal ulcerations, dysphagia, aphonia, perforation of esophagus, mediastinitis and pneumothorax. So mainly because of corrosion there is ulceration of mucosa. Ulceration leads to bleeding and also there may be perforation. So all these symptoms can be explained by because of corrosive action. There is ulceration, there is nausea, vomiting, there is hematemesis, there is perforation of esophagus, mediastinus. So this bleeding can cause mediastinus and pneumothorax. In kidneys it causes decrease in urine, that is oliguria, non-oliguric kidney failure due to acute tubular necrosis, proximal tubular dysfunction. In lungs causes cough, hematemesis, dyspnea due to pulmonary edema, hemorrhages or fibrosis. In pancreas it can cause pancreatitis mainly because of its radicals. It causes cell death. Then in liver causes central lobar hepatic necrosis and cholestasis. In CVS it causes hypovolemia, shock, arrhythmias. CNS late coma, convergence, cerebral edema. In adrenal it causes insufficiency due to necrosis. And in bone marrow it can cause polymorphonuclear nucleocytosis and anemia in later stages. So in most of the organs it acts and causes disrupts their cellular mechanism and causes symptoms related to their system. Fetal dose of paraquat is 10 to 5 grams, 5 to 10 grams. Injection of more than 50 mg per kg kill within 72 hours. Fetal period is 2 to 5 days. Come to cause of death. Death occurs from multi-organ failure or corrosive effects in the GI tract. Death from esophageal perforation and mediastinitis can occur within 2 to 3 days of ingestion. In ingestion of less than 3 grams, death occurs from 5 days to several weeks. So mainly because of corrosive action, it causes multi-organ failure. In each of the organs, it causes cell death. Because of corrosive effect, it can cause perforation or mediastinitis, where the person may die within 2 to 3 days. Coming to treatment, the first, the person's clothing is removed and washed thoroughly to soap and water to remove unabsorbed poison. Gas lavage may be beneficial if done within 1 hour of exposure. Emetics are contraindicated in case of paraquat because it is a type of corrosive, so it has a corrosive action. So because of corrosive action, emetics are contraindicated, but gas lavage can be done to remove unabsorbed poison. 1 liter of 5 to 30% of aqueous suspension of fuller's earth or 7% bentonite or activated charcoal are given to absorb the paraquat, followed by 200 ml of 20% mannitol. So there are three options: fuller's earth or bentonite or activated charcoal. So these are all acts to remove and absorb the paraquat from the stomach, followed by gastric lavage. Hemodialysis and hemoperfusion is usefully done within 12 hours of injection. Oxygen therapy is avoided mainly, and analgesic is given to relieve any pain. Coming to postmortem appearance, there may be ulcerations around the lips and mouth. Mucosa may be radiant. Esophagus may contain cast or shed epithelium. Stomach may show erosions and patchy hemorrhages are maybe normal. The kidneys may show cortical pallor or diffuse tubular damage. A helen is often seen in the organs. Diffuse pulmonary edema hemorrhages may occur. Alveoli begin to fibrose with reticulin and collagen being laid down to form a rigid, stiff lung. Lungs may be mistaken for diffuse pneumonia. There may be fibrinous pleurisy and sometimes slight bloody pleurophasia may be seen. The liver may show pallor, motile fatty changes, and central necrosis. So most of the organs show corrosive effect with inflammatory reaction. In kidneys, liver, and lungs show the major changes will be present. Coming to next poison, that is the pyrethrins and pyrethrines. Pyrethrins and pyrethrines are extracted from the chrysanthemum plant. So these are the plants which are usually available, and they are extracted. Pyrethrines are synthetic forms of pyrethrins. So pyrethrins are from the plant flowers from chrysanthemum plant, and pyrethrines are synthetic form of pyrethrins. Toxicity is very low due to their rapid metabolism. So whenever if the person even consumes, they metabolize and excreted readily. So poisoning is toxicity is very low. Though they are used mainly for insect as a form of insecticide, mainly in mosquito repellents, they are usually present. So commonly the mosquito repellents usually have the paraquat pyrethrins compounds. They are used as insect repellents, insecticides, and pesticides. They are available as sprays, dust, powders, mats, and coils. Pyrethrum, pyrethrin, dialethrin, permethrin, diamethrin, decamethrin, expiromethrin, phenphthalate are some of the examples of pyrethrin or synthetic forms. Again, they are mainly used, popular uses as mosquito repellents. They are used. Any mosquito repellents, coils, or liquids consist of pyrethrin compounds. So commonly they are used for as a mosquito repellents. Come to action, they prolong the inactivation of sodium channel by binding to it in the open state. So these pyrethrins combine with sodium channel in the body and causes the repeated firing of nerve, leading to hyperexcitation of the nerves, leading to incoordination, paralysis, and death. Usually it is seen in insects, but in humans it causes minimal effect because of easy metabolism. Signs and symptoms: skin contact causes dermatitis and blistering actions. There may be paresthesia, nausea, vomiting, vertigo, fasciculations, hypothermia, altered mental state, convulsions, pulmonary edema, and coma. So usually the CNS symptoms are commonly present. Fasciculations are seen. There may be altered mental state may be seen, convulsions may be seen, and person may go in coma and die. Inhalation causes rhinorrhea, sore throat, wheezing, and dyspnea. Fetal dose is 1 gram per kg body weight is fatal. So in higher doses, very high dose of pyrethrins compound only can cause the death of a human. Treatment: skin should be washed with soap and water. Stomach wash with charcoal is given if the person has consumed pyrethrins. Oils and fats should be avoided. Atropine and axomies are contraindicated in this and is not given. Mainly adrenaline is given 0.5 to 1 ml in 1:1000 mIM for allergic reactions. Antihistamines such as chlorpheniramine or promethazines by IV injections are after adrenaline is given. Coming to next poison, that is dinitro compounds. So dinitro compounds includes diatrocresol and dinitrophenols, which are commonly used as a weed killers. They are also used to kill insects and fungi and preserve the wood. They act generally by greatly increasing the cellular metabolism of any cell with which they come in contact. So whenever dinitro compounds come in contact with any type of cell, they increase their cellular metabolism and cause death, cell death. They are absorbed orally through skin and respiratory tract. Inhalation and ingestion may occur by spraying of crop spraying. It can be inhaled. Fetal dose is 1 to 2 grams. Fetal period is 4 to 15 days. The person may die. Symptoms: they appear rapidly and resembles of thyrotoxic crisis. Yellow discoloration of skin and hairs and rashes are seen. Burns of lips and buccal mucosa may present. In CNS, the person may go anxiety, restlessness, tiredness, insomnia, convulsions, and coma may occur. In CVS, there may be tachycardia and arrhythmias. In the respiratory system, there may be tachypnea, pulmonary congestion, metabolic hyperpyrexia, intense perspiration may present. There may be acute renal failure, acute liver necrosis, and severe irritations and redness of watering may be seen in the eyes. So in most of the cells, any part of the body, wherever it is absorbed, it causes decreases its action. It can cause renal failure, it can cause liver necrosis, it can cause hyperpyrexia, hormonal releases, tachypnea in respiratory system, arrhythmias in CVS. So mainly it alters the mechanisms and metabolism of cells of organs and causes symptoms related to that. Treatment is mainly symptomatic. There is no specific antidote is not present for dinitro compounds. The symptomatic treatment is done. Coming to fluorides. So sodium fluoride is used as a rat poison and cockroach powders. Sodium silicofluoride, fluoroacetamide, and fluoroacetate are used as rodenticides. So fluorides are commonly used as a cockroach powders or rat poisons. Fluoride compounds react with acid in stomach and form hydrofluoric acid, which is corrosive in action. So for toxic effect of fluoride is mainly because of fluoride coming in contact with HCl, which is present in the stomach, which forms hydrofluoric acid. After absorption, fluoride ions bind calcium ions and some extent potassium and magnesium ions and cause hypercalcemia, hyperkalemia, and hypermagnesia. So once the fluoride comes in contact with HCl, they form hydrofluoric acid, and fluoride ions can enter the blood. In the blood, they bind with calcium ions, potassium ions, and magnesium and lead to hypercalcemia, hyperkalemia, and hypermagnesemia. Fluoride ions also inactivate proteolytic and glycolytic enzymes and act as a generalized protoplasmic poisons. So they also inactivate proteolytic and cause glycolytic enzymes present in the cells and cause protoplasmic poison. 5 mg per kg body weight is fatal of fluoride compounds. Ingestion causes burning pain in the mouth and epigastrium. There is increased thirst, salivation, vomiting, diarrhea, hematemesis, and hematuria. Coma and convulsions may occur. Death may occur within minutes from respiratory and cardiac failure. So because of action of fluoride compounds in the cells, it can cause hematemesis, corrosive action, hematuria, as well as coma and convulsions, and person may die within minutes from respiratory and cardiac failure. Treatment: calcium is given orally or intravenously. Stomach wash with lime water or milk is given, and there is no specific antidote for fluoride poisoning. These are my references. Thank you.